Hi, I'm Dr. David Hill, and I'm going to talk to you today about quitting smoking. I'm a family practice physician, and so I talk with patients almost every day about quitting smoking. While smoking is a very common thing, it's also been decreasing in the last number of decades. That's important, but at the same time it still remains the number one cause of preventable mortality in America. Smoking not only affects the smoker, but also the people around the smoker that are exposed to the secondhand smoke. When it comes to the risks of smoking, most people think of lung disease and cancer, which is correct, but also there's an increased risk of heart disease, such as heart attacks, strokes. For many people, even with other diseases like diabetes, quitting smoking can be one of the most effective things to help prevent disease for them as well. When it comes to quitting smoking, there can be a lot of challenges, but we're going to talk about some of the challenges and how we can overcome them, and some of the things that we have, such as medications and behavioral therapies that can help with quitting smoking. So what are some of these barriers to quitting smoking, and which makes quitting smoking so difficult? One of these can be just getting the motivation to want to stop. Smoking obviously is pleasurable, or people would not do it. The nicotine acts on the brain and gives someone a feeling of euphoria or pleasure. And so taking this away often causes the opposite feelings, that they have the displeasure, the depression or irritability that comes along with the quitting. For other people, it can be not just the withdrawal, but the social aspect of smoking that can be difficult for them. Often people smoke around friends, family, colleagues at work, and so quitting this often hurts their social life as well. Often there's triggers that cause people to have cravings for tobacco, such as alcohol or coffee, even after meals, and once again with coworkers or with family. So these triggers make it difficult to ignore those cravings and to quit smoking. So there are some other barriers as well. Often smokers have to try many times before they can quit smoking successfully. This becomes a challenge because with each failure, a lot of times people feel like they just can't do it, and yet they forget that there are things out there that can help them. About 70% of smokers say that they want to quit, and about 40% actually try every year. Only about 25% of smokers actually seek out help for quitting smoking. And without help, only about 3 to 7% of smokers actually quit smoking and are smoke-free a year later. So this presents a real challenge to quitting smoking. When it comes to some of the things that can help, there's several different options, and each one can be tailored or at least tried for different smokers to really have success. So what are some of these options to help with quitting smoking? With optimal treatment, and I'll talk about some of those treatment options, about 30% of smokers are smoke-free a year later, which is a big improvement from 3 to 7% if someone tries to do it on their own. Now the first of which is behavioral, and when I say behavioral, it's kind of those triggers that cause people to have those cravings, and how can we make it not quite a part of everyday life, which it has become. So with behavioral therapies, there are things like talking to a doctor or a physician to give some pointers and to help with strategies to help quitting. But there's also many other things. There's quit lines like the 1-800-QUIT-NOW, which is a national hotline that people can get help with quitting smoking. There is also computer and smartphone apps that people are able to use now, which is kind of a new development, and is exciting that people can have those with them on a daily basis. There's also getting their coworkers or family members involved, since some of them can be the triggers for quitting smoking. When it comes to group activities, it's a little more intensive, but actually more successful, that there are some groups in most cities that have smoking groups that they get together to help with quitting smoking, similar to an AA meeting for an alcoholic. When it comes to medications that can help, there are several options. There are over-the-counter things such as nicotine lozenges or gum that can be purchased at most stores, including convenience stores, that can help take the cravings away as the nicotine withdraws from their body, which usually lasts for several days. It also helps get them out of the habit, such as the smoking after coffee or with alcohol or with friends, so that they don't have quite the same cravings or urge that they had without the cigarettes. There's the new e-cigarettes, which are kind of a new development. They are unstudied, but they are a form of getting nicotine without the cigarettes themselves. And while the jury is still out on whether they are effective for quitting smoking, some people have found some benefit and may be worth a try for some people. There are some medications that can be prescribed, such as bupropion, or another name is Wellbutrin or Zyban is the trade name, that can be prescribed that help reduce the cravings. Now, for some people, even these aren't enough, and sometimes a combination is needed. Another medication that can be used is, the trade name is Chantix, or varenicline. That is a medication that actually attaches to the same receptor in the brain, or the same area in the brain that is where the nicotine attaches. And with that medicine, it not only binds there so it prevents nicotine from attaching there from someone who is smoking currently, but also reduces the withdrawal. So it kind of has a nice double effect that can help people quit smoking. So these medications are effective, and there's not one that is necessarily more effective than another, and so it really needs to be tailored for each individual person, and so that's why seeing a physician would be helpful for that. Part of the reason is that certain medical illnesses or mental health disorders need special attention with the use of some of these medicines. So what do you do if you tried or you have tried and have failed in quitting smoking? Well, the first thing is not to give up. Most smokers within 30 days after quitting smoking and failing want to try again. It's also important to understand that most smokers take several tries before they successfully quit. And quitting is very difficult even at 5 years after someone has quit their last cigarette. There's a high rate of relapse or smoking again even within that time period. So it's important to still seek out help and not feel like you've conquered smoking just because it's been a certain amount of time since your last cigarette. The other thing is that most people that have quit really haven't tried everything, or at least used all the options that are available. So it's very important to give multiple tries with different ways of going about trying to quit smoking, whether that's through medications or the behavioral therapies. Those are all things that need to be tried, sometimes in combination, to really have success. So the most important thing for you is really to just keep trying, and if you're not having success, to seek out some help, because there are really good options available.